7 medications that could damage your heart according to the World Health Organization. Greetings to distinguished health lovers. Each year, more people die from cardiovascular diseases than from any other cause. Heart diseases are also responsible for a large number of disabilities and a significant deterioration in quality of life. Every day, it is observed that heart diseases start at earlier ages, which is due to poor lifestyle habits and the fact that preventive measures have not yet become widespread enough to influence a decrease in this incidence. Several well-known cardiac risk factors include diabetes, obesity, a diet rich in saturated fats, a sedentary lifestyle, and smoking, among others. However, there are other factors that can worsen heart disease, and some of them are the chronic consumption of certain frequently used medications. Did you know that cardiovascular disease can worsen due to common medications? Do you know which medications affect your heart? You might be surprised by some of them. If you want to learn more about this interesting topic, stay tuned to this video and learn about the negative influence some medications have on the heart. Heart failure is one of the most diagnosed serious diseases after age 65. Heart failure is the long-term consequence of many cardiovascular diseases and is a weakness or failure of the heart muscle that manifests clinically in various ways. Heart failure is a very common cause of hospitalizations after age 65, and there are many expenses or investments that insurance companies and governments must make to manage all the complications associated with this disease. In many cases, heart failure requires long and costly hospitalizations. Epidemiological studies have shown that the proper use of medication in patients taking multiple treatments for multiple simultaneous diseases, such as in the case of elderly people, reduces the number of hospitalizations and their duration. This is because almost half of all patients have up to 4 or 5 simultaneous chronic diseases that require specific treatments, and therefore, great care must be taken with drug interactions. Among the diseases most commonly associated with heart failure are osteoarthritis, chronic kidney disease, diabetes mellitus, hypothyroidism, and obesity, in addition to chronic respiratory problems such as chronic obstructive pulmonary disease, COPD, and emphysema, generally associated with smoking during youth. This means that many patients with heart failure simultaneously take many medications. It has also been determined that patients with 5 or more chronic diseases have an average of 14 visits per year, compared to 1 to 2 visits per year when only heart disease is present. Most medical visits are due to adverse effects or interactions between medications. The proportion of complications and actions of people with heart failure is proportional to the number of simultaneous chronic diseases and the number of prescribed medications. A scientific study revealed that people with 2 prescribed medications, apart from those administered for heart failure, have a 13% higher risk of experiencing some drug interaction. This percentage rises to 38% when they have 4 medications, and even 82% when more than 7 medications are taken simultaneously. Here are 7 medications that could damage your heart. But before we start, don't forget to subscribe to the channel and like the video, and make sure to watch the video until the end, because the information that we will cover in this video is very important. So let's get started. Number 1. Nasal decongestants. Among the medications shown to affect the heart are nasal decongestants. Most nasal decongestants are sold without a prescription and sometimes have various components. The classic component is pseudoephedrine, which has been used less due to cardiovascular effects. However, it is still used alone or in combination with other pharmacological elements. Pseudoephedrine, as well as phenylephrine, can cause changes, increasing blood pressure and heart rate, raising the risk of arrhythmias, and potentially causing decompensation of previously controlled heart failure. It has been shown that nasal decongestants, even when used topically through drops can have cardiac effects. The main use of decongestants is in common colds or allergic rhinitis. Most cases have a very short action duration, so people tend to use them repeatedly during the day, increasing the risks of their adverse cardiovascular effects. The effect of nasal decongestants is based on causing vasoconstriction or narrowing of blood vessels in the nasal mucosa and paranasal sinuses, thereby reducing edema or swelling and the drainage of inflammatory fluid or mucus, which together cause nasal congestion. Although pseudoephedrine and other nasal decongestants have a direct cardiovascular effect, the doses commonly used are quite low, and in general, it is safe to use them at recommended doses for short periods, provided there is no underlying heart disease. Today, there are other alternatives available in saline solution-based nasal sprays and anti-allergics that do not have a direct effect on the cardiovascular system and are safe for most patients. Common colds usually last 2 to 3 days at their peak symptomatically and can improve spontaneously without the need for decongestant medications. Number 2. Nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs include medications like diclofenac, ibuprofen, indomethacin, ketorolac, ketoprofen, and naproxen, among others. All these medications are commonly used and in most countries can be purchased without a prescription. They are frequently used for pain relief, inflammation reduction, and to lower temperature or fever. What few people know is that these anti-inflammatory medications have a whole series of adverse effects, including cardiovascular effects. These medications affect many organs, including the kidneys and the digestive system. Several studies have shown an increase in blood pressure and a higher risk of heart failure after taking NSAIDs. These medications can cause sodium and water retention and also decrease a substance called prostacyclin, a natural vasodilator. Hence, the risk of increased blood pressure with these medications is a secondary effect that can be observed with all NSAIDs, except for aspirin when taken at low doses. Inhibition of the production of some vasodilatory substances in the kidney, such as prostaglandins, also reduces kidney filtration rate and causes sodium and water retention. These effects can decompensate a patient with existing dilated cardiomyopathy. Among NSAIDs, ibuprofen is the most commonly used by the population. A study reported that heart failure patients decompensate up to twice as much when anti-inflammatory drugs are administered, especially in patients who also take diuretics. This effect can be observed within a few days of anti-inflammatory treatment. There is also an increase in the number of hospitalizations and the prolongation of the same when anti-inflammatory drugs are used in people with dilated cardiomyopathy or heart failure. This highlights that people with previous cardiovascular problems who additionally take medications such as diuretics or some types of antihypertensives like enalapril or captopril should avoid the use of NSAIDs like ibuprofen. Scientists estimate that NSAID consumption could be responsible for 20% of the cases of newly diagnosed congestive heart failure decompensation. Number 3. Diabetes medications. Diabetes mellitus is an increasingly diagnosed disease that is very frequently combined with chronic cardiovascular problems. It is not uncommon to find patients taking medications for both the heart and diabetes simultaneously. Diabetes treatment, in addition to diet, lifestyle habits, and physical activity, also involves the correct use of medication. In some cases, treatment is based on daily injections of some type of insulin, calculated according to weight, activity, and patient requirements. However, diabetes can often be treated with oral medications called hypoglycemics. There are several types of hypoglycemics, and some of them have been associated with a deterioration in heart function. For this reason, these medications are prescribed under strict medical supervision and should never be modified in dose or combined with other medications medications without your doctor's approval. Among the most commonly used diabetes medications are thiazolidinediones like pioglitazone and rosiglitazone. These medications have been shown to cause fluid retention and even weight gain, which decompensates patients with diagnosed heart failure, increases the likelihood of cardiac symptoms, and the probability of hospitalizations. Other more recently used diabetes medications are dipeptidyl peptidase 4, DPP-4 inhibitors such as alogliptin, linagliptin, saxagliptin, and sitagliptin. Although the exact way these medications can worsen heart failure is not known, some medical reports have shown that the combination of this type of medication in patients with chronic heart conditions can cause heart failure symptoms. Metformin might help reduce the risk of heart failure. An analysis that compiled information from over 200 scientific studies worldwide, including more than 1.4 million people using metformin, determined that this drug, frequently used to treat type 2 diabetes mellitus, can reduce the risk of heart disease complications or directly decrease cardiovascular mortality by 30 to 40% compared to other diabetes medications. The study evaluated approximately 12 different diabetes medications and determined that only metformin improved the cardiovascular profile of diabetic patients. Despite these results, the potential effects of these medications are still being studied since. Although they have a good cardiac effect, metformin is not a medication used for all type 2 diabetics because its effect on lowering blood glucose is very direct, and most patients need additional medication to control their blood glucose levels. All medications used for type 2 diabetes, including metformin, also have gastrointestinal and metabolic effects, so the choice of medication and dosage must be carefully evaluated by your treating doctor individually. However, the use of metformin seems safe not only for heart failure and cardiovascular diseases, but also to improve life expectancy and provide better morbidity in cardiac and diabetic patients. Number 4. Itraconazol. Itraconazol is an antifungal medication frequently used, but with several dose-dependent side effects such as nausea, vomiting, and other common side effects when more than 400 milligrams per day are exceeded. Adverse effects of itraconazol include potassium loss, altered liver tests, gastrointestinal disorders, diarrhea, and skin rash, but there have also been several cases of congestive heart failure. The mechanism by which itraconazol can cause congestive heart failure is unknown, and cases have been detected in patients who were cardiovascularly healthy before the administration of the antifungal medication. Itraconazol can be used in patients with immunosuppressive disorders like HIV and in people with fungal infections like histoplasmosis, aspergillosis, and sporotrichosis, among others. The consumption of itraconazol can cause heart failure in any patient, but those with cardiovascular problems should avoid its use as much as possible. Number 5. Medications for Crohn's disease. Crohn's disease is a chronic inflammatory disease of the gastrointestinal tract. In recent years, several medications have been used to control it, especially those that inhibit a substance called tumor necrosis factor. These drugs are often called biological therapies and are widely used in patients with severe Crohn's disease or ulcerative colitis. Among these medications, etanercept, infliximab, and adalimumab stand out. These medications, which can be administered subcutaneously or intravenously, have cardiovascular effects. The most severe effect is the deterioration of previously compensated heart failure or even the occurrence of new heart failure. A review study that included information from 26 different studies and evaluated more than 16,000 patients revealed that these medications can increase the risk of worsening heart failure in up to 25% of patients treated with biological therapies. The scientific explanation for this observation is unknown, but it seems to be related to the biological effect of these medications. For this reason, any patient using these medications for inflammatory diseases should be monitored periodically by their treating doctor to evaluate the occurrence of cardiovascular adverse effects and to decide, if necessary, whether to suspend the medication, change its dose, or switch to a different one. Number 6. Chemotherapy medications. Chemotherapy is a treatment often used in people diagnosed with some type of cancer. Although cancer diagnosis rates have increased in recent years, there has been significant progress in cancer treatment. However, it is known that one of the main side effects of most chemotherapy medications is cardiotoxicity. Although there are medications to treat cancer that have a lesser effect on the heart, chemotherapy continues to cause heart problems and some more serious side effects. A study involving a large number of patients showed that 10% of chemotherapy patients had some heart disorder due to cancer treatment. The mechanism by which chemotherapy medications can cause heart failure is unknown, but it is believed to be dose-dependent. Heart failure from chemotherapy is not usually associated with symptoms, and most patients are unaware of this potential effect until advanced studies are done. Among the most widely used chemotherapy drugs are anthracyclines such as doxorubicin. These medications can cause serious heart failure, leading to the discontinuation of cancer treatment in many patients. Hence, patients receiving chemotherapy treatment should be monitored by their treating doctors and undergo periodic evaluations with diagnostic tests to monitor heart function and detect potential deterioration early. Chemotherapy treatment requires specific indications for cardiovascular monitoring, and in some cases, cardiac medications such as diuretics or specific antihypertensives may be prescribed to compensate for heart failure symptoms. Patients should always consult their doctors before discontinuing any medication. Number 7. Central nervous system. Medications used for diseases of the central nervous system include psychiatric medications like antidepressants and antipsychotics. These medications have been studied extensively for their cardiovascular effects. Some of the most used drugs in this group include haloperidol and risperidone, which have a direct effect on the heart by prolonging the QT interval. This interval is a phase of the heart's electrical activity, and its prolongation can lead to an increased risk of arrhythmias. Some of the most dangerous and potentially fatal arrhythmias can lead to sudden cardiac death. Although the incidence of this adverse effect in the general population is low, it is important to consider this potential complication when there are cardiovascular problems. Prolongation of the QT interval is seen more in patients with congenital heart disease. This adverse effect of antipsychotic medications has been widely documented. One of the most critical moments for these drugs to generate arrhythmias is at the beginning of treatment, when the patient can experience acute heart failure due to the drug, and also with sudden cessation of treatment, which can also trigger heart failure. We hope this information has been helpful to you. Do not forget to consult your doctor if you experience any symptoms, stop taking any of the medications mentioned, or if you notice any cardiovascular discomfort. All this information is scientifically validated and updated. Stay tuned to our channel for more health advice. See you next time.